Namaskar. Welcome to Ahara Arogya Adhyatma, the light of Samskara. Today we have a renowned gynecologist and obstetrician who is a colpologist and also robotic surgeon who has set a Guinness World Record in screening the cervix cancer. And today she is going to talk about the most basic investigation that is required whenever a woman gets pregnant, and that is the scanning or ultrasound. So let us learn from her what is ultrasound, why it is done, and when it has to be done. Welcome, Parimala Devi. Namaskar.
Thank you, madam. Thank you, and my respectful pranams to you, my teacher who taught me ABCD of medicine. Now also I can diagnose some of the medical condition along with my obstetric gynecology. That's because of you. Because the teaching was so much superb. As now you can understand by hearing you, many people will know how good a teacher you are, like that. Now, today, madam, we thought of putting this topic into the public and our dear ladies, because there are a lot of queries why these doctors are doing so many ultrasonologies, especially our elderly women, maybe my aunt or somebody's grandma. We all delivered 3 children, 4 children without any scanning. These days, they want to make money by doing all this instrument. This
Yes,
is a
yes.
common problem we hear. But that is
Comment.
because of their innocence. That's because of their innocence. We need not get annoyed
Ignorance. It
when
is
we
not innocence, it
ignorance.
is
When
ignorance. Yeah.
ignorance. So when we tell them why this is done, then they will usually understand and again thank us and go. What I want to tell, pregnancy is a condition. It is one of the very special moment for the family and for that lady. The arrival of a new baby is something like very much welcomed and awaited by most of the families. There is no family like we don't want the baby to come into another our family anything. But this baby which is going to join their whatever family, whatever we say like kutumba, what we have in Kannada, but that baby, how healthy it is, that is
Correct.
very important. Nobody
Yes.
wants a sick baby or anything to come to the family. Any baby which comes to the family, any human being wants to be healthy and wants all the family members also to be healthy. So
Mentally,
under
physically healthy baby which has
physically,
got no anomalies, so that
yes, madam,
they don't
yes,
have to go for the repeated surgeries and the survival
correct,
difficulty. So that is the most
correct.
important. Yeah.
Yes. Then that is the time like when a lady comes with her family or with her husband or with the mother-in-law, mother, she usually is looking for a pregnancy. She thinks that she has missed the cycle and she comes happily for a checkup. When she comes to us for the checkup, then we will be usually seeing her pregnancy test or sometimes beta HCG hormone test. Whatever it is, but if she has already finished 1.5 months or something, then we will ask her, Amma, this is all, everything is okay, but please do one dating of pregnancy scan, we say. That's around 6 weeks. Because till then, we will not be seeing the heartbeat of the baby or anything. So the
Yes.
heartbeat first starts appearing along with a fetal pole and a yolk sac there on the sonology finding. This is very important because some of the pregnancies may not develop the heartbeat only. They may not develop the yolk sac, the fetal pole, which will give all the organs as the baby grows. So the basic scan of dating of pregnancy scan at 6 weeks or so
Very, very
is very, very
important.
important. Important. We will not do it in 4 weeks or 5 weeks. First, we will wait and we'll ask them to rest a while and not to do unnecessary work. And then when you are finishing 1.5 months plus, please come back for a scan. Now, for time being, pregnancy test may be positive, but there can be some fallacies in pregnancy test also. If she has
Yes.
taken some higher antibiotics, she had fever, that time also false positive pregnancy test can come. So we will make
Come.
them understand. If the
Yes.
pregnancy dating scan comes normal, our next scan is one which we do at 3rd month. That is very,
Okay.
very important. They will ask, what, madam? Now only finished one scan, and again you are giving a date for the next scan. What is this, madam? Why
That
you
is
are
the
doing this?
anomaly
That
scan.
time,
Anomaly
uh,
scan to detect any
it is a more
anomalies.
than the anomaly, it is a nuchal translucency. Madam, in
Okay.
our country, we have nearly 30 to 35% of brain anomalies and neurological abnormalities baby, which is born with a spina
Like
bifida at the back
spina
of the spine
bifida.
or a
Yeah.
big hydrocephalus. And because of that, it's our duty, and we have come with so much of revised rules and SOPs that the 11 to 12 weeks when that nuchal means that cord
Very
is
small. Yeah.
erupting, we have to measure it and document it along with, madam, one
Nose.
important nose.
Hmm.
nose. I may have a blunt nose, a sharp nose like you may have, but the nose which is appearing
Yeah,
along with nuchal consistency is a good indicator that she is neurologically growing very well, her
good. Mm,
child.
mm.
Because if there is any discrepancies, then we have to do some other test and to confirm that there is no neurological abnormality or Down syndrome or some genetic problems baby may develop or it is developing. So this is another second important scan, madam. So third scan is when she gets into the 5th to 6th month, madam. Very much your specialty, cardiac. The heart, which is developing all its four, whatever the we say like kavata
Chambers,
or the
chambers and
chambers,
the
is
valves.
very very important because there may be some leaflet problem or there may be some aortic problem or some few things we can definitely make out
If
people
very,
say
we don't think we do the at that if there is ultrasonograph shows any abnormality, and that patient is referred to us for the pediatric
yes
cardiologist
yes
to do
madam,
the
yes madam,
fetal echocardiography. So when
echocardiography,
we concentrate on the fetal echocardiography, we will know whether it is a complex congenital or the simple congenital heart disease. So if it can be treated, we advise them don't worry. If it is a complex one, sometimes we'll have to terminate after doing the genetic counseling, because the genetic, some genetically transmitted syndromes are the ones, which are very very dangerous, and
yes
for that,
yes
we have to do it at that time. Okay.
yes. So
And that
after
too
this
before
anomaly scan,
the MTP time is there, no, before that only we have
yes,
to
it is
do
not possible, madam. Usually after
after.
5 months, it's not possible. And we always wish them that everything should go well. But there will be
Yes.
always some 4 to 10% of the cases because of the
Mm,
consanguineous marriage. It may be or some viral insult in the early pregnancy. Or
mm,
sometimes in the IVF also we see some of the abnormalities because of this in vitro fertilization, genetic
mm.
changes. So all these
Yes.
things will make us to understand 20 to
Mm.
24 weeks. This anomaly scan is very important
Very
to find
important.
out whether the kidneys, everything are normal. After
Correct.
that, these three are very, very important. It's a must and should, madam. If they
Mm.
refuse, also we'll have to document it because at the end, if the abnormal baby is born, then they will blame the doctor. We showed you, you didn't tell us, we would have removed the baby. So we document it and we explain to them. Even in spite of this, there are some problems like now diabetes with pregnancy, very
Yes.
elderly women
And
conceiving 40 years
hypertension with
plus because of
pregnancy.
the in vitro fertilization, cardiac health problems and pregnancy. There are so many types of high
Problems.
risk pregnancies now.
Mm.
Because of that, we keep one scan at the end nearly about 32 to 34 weeks or 34 to 36 weeks. Well,
Mm.
we will come to know whether everything is fine and we will be able to give her a good
And the
delivery and a
baby has
carry.
grown, whether the weight is gained or not,
Yes,
whether
wait.
gaining of the weight is more or less. Both are very
More or
important.
less.
Yeah.
Because, madam, you raised a good point. Because in diabetes, it can be a very big baby, macrosomia, all organs
Mm.
big, or it can
Mm.
be a old man
Very.
look baby, we say.
Yeah.
Small for the date. Old man.
Yeah.
When it's born, it looks like one old aja. Otherwise, it
And they
is
may die,
motu.
and it may be stillbirth. So we have,
And may
it is
require
very risky,
NAC.
and we have to tell.
Yes,
Yeah.
yes.
And
So these
they
are all
should not
very.
blame the obstetrician for that.
Yes, yes. And the whole blaming the doctors has become a fancy, but these are the things. And one more
Yeah.
thing, the last point I want to tell, so many scans we are doing, is it not going to affect my grandchild or this
Baby.
one? Most of the elders will ask, the scan effects on the baby, ultrasonography on the baby.
No.
No. In the 40 years of ultrasonography life journey, there are no side effects because it is sound waves which are used, the crystals,
Mm.
ultrasonography crystals, they will not give rise to any type of side effects which is not reported. Whereas
It
in
is not
X-ray,
like an
shock
X-ray. Yeah. In
X-ray.
X-ray, they are the
X-ray
very
is of
dangerous
course
rays are there. Yeah. Yeah.
dangerous rays are there. So there is a difference. It's entirely a total. This one it is not at all like X-ray. So happily, whenever required, how your doctor explains, please go for a sonography and have a very healthy baby. This is regarding pregnancy because
Mm.
ultrasonography has become one of the very important tool for us. Like it has become like our third eye. Through that,
Mm.
our diagnosis is so much mixed up. We can
Mm.
come to like high risk diagnosis. Anything is there we can do and try to help the lady and the
And
families,
that's why
everything.
the cardiologist still carries the stethoscope. Obstetrician like you don't carry the stethoscope, because
Yes, madam.
everything is shown by the ultrasound picture. So that's
Yes, yes,
you are the third eye you have got. That is very
yes.
nice. And
Ultrasonography in obstetrics. My colposcopy, because that's very favorite of me, colposcopy in gynecology. Both are third eye of Shiva.
So you can make the precise diagnosis and advise
Yes.
them accurately. So without any
Yes, ma'am.
fallacies. So nowadays the people are having just one child or two children, and if they are not healthy, their life gets doomed.
Yes,
You know,
madam.
that's very,
Before
very important.
4
Yeah.
or 5 children they used to have 1 or 2 die also. There was
They
no
never used to
instrumentation to
bother.
find out. Now it is the best part of the treatment is going on, we can say, in this era.
Yeah, yeah. And so the people should not ask, why are you doing? Or even if they ask, they will understand. So now that
Yes,
you
ma'am.
have explained so beautifully and so nicely, and I'm sure those who have understood will not ask the obstetrician, why are you doing the scan, or why are you doing so many times, you know. And it is so very nice. And thank you very much, Parimala Devi. You have told us what is ultrasound or scanning, why it has to be done, when it has to be done, and not only that, the utility and how important it is, like a third eye of Shiva, how it gives the precise diagnosis, and that is also very important. So thank you very much for your
Thank you,
thank you.
madam. Thank you. Thank you for the opportunity, madam.
Thank you.